Eradicating the scourge of child sexual abuse is a hurdle for many governments across the Caribbean and globally. Health Minister Ronnie Skelton has stated that child sexual abuse cases are on the rise in the BVI.
Of particular concern to us is the fact that since 2010, the number of sexual abuse cases that has been the leading type of abuse in the territory. This local and regional trend has resulted in a regional response with the Bridgetown Declaration and Agenda for Action.
Minister Skelton was speaking at a training workshop on children's rights and the Child Protection Protocol signed on October 1, 2014, mapping out a cohesive approach in keeping with the Bridgetown Declaration and Agenda for Action to combat child sexual abuse in the Caribbean. The BVI is the first among the overseas territories in the region to sign the protocol.
We just received a letter of congratulations from the head of the UNICEF regional office, the BVI being only the third Caribbean country or Caribbean jurisdiction to have a formal child protection protocol in place, and the first among the overseas territories in the Caribbean. So we're very proud of that, and it's a demonstration of our commitment to protecting the children of the Virgin Islands and the wider region.
In the Caribbean, 47.6% of girls and 31.9% of boys have reported that their first sexual intercourse was forced or coerced by family members or family acquaintances. According to the 2012 BVI Youth Health Sexuality Report, 37% of children in the BVI ages 12 to 19 are having sex. 6% of children ages 12 to 19 are abused through transactional sex. 20% of those surveyed said they were forced into sex the first time.
It continues to be a challenge. We recognize that the work continues to not just respond more efficiently to reported cases of abuse, but to ensure that we can intervene much earlier and prevent child abuse from happening in the first place. So we recognize the need to continue, efforts to build capacity and educate the public, including children, on their rights and how to address challenging issues before they escalate to the point of child abuse. All the agencies have expressed and demonstrated a commitment to strengthening the system to protect our children. And so we've taken the time to conduct this training so that we're all clear as to what is expected, and coming out of this week, we're even more confident in the level of commitment and cooperation that we can expect from our partner agencies, so we're very excited about that.
Child sexual abuse occurs in all socio-economic, religious, and ethnic groups and affects children of all ages, including infants. Most often, 70 to 80% of the victims are girls. In 50% of the cases, the perpetrator lives with the victim, and in 75% of the cases, the abuser has a direct relationship with the victim.